Good morning everyone. Today I am going to talk about the topic post-traumatic stress disorder. PTSD is a mental health condition triggered by experiencing or witnessing a traumatic event such as combat, assault or disaster. Combat means a war. Okay, so normally PTSD it happens during the World War, or it may happens to the soldiers, and even if it is a death of a loved one, so automatically it happens to the persons who missed something. It's like a traumatic thing one. And next, not everyone exposed develops it. Symptoms persist beyond 1 month, disrupting daily life. So everyone, we can't say that all the one have experiencing this kind of PTSD. No, it depends upon the traumas that they are facing in their early life and childhood experiences, and the symptoms keep on persisting till 1 month, and it automatically disrupting our normal daily routine life. It affects 0 to 8% of the adult's lifetime, higher in veterans and assault survivors. Veterans means the soldiers who are working during the war period, and assault survivors that already they've been physically challenged, or something happened to them during the war period. And now I am going to talk about the history of PTSD. First recognized as a shell shock in World War I, later combat figure in World War II. So shell shock means it becomes a bigger thing that they may have lost their body, or lost their close friends, or lost their parts of their body, something like that. Okay, so according to DSM, that is Diagnostic Statistical Manual 3, it formalized PTSD diagnosis in 1980. It evolved with research on trauma responses across cultures. So the trauma, if you see the trauma, it may happen to all kinds of people across different cultures, and they may also have different kinds of responses will be there. If we talk about the risk factors of PTSD, prior trauma history, childhood adversity or lack of support post-event. That means they may have some sort of histories will be there, that during the childhood period they may have undergone some sort of traumas like that, and even that time they don't have any support. It affects in the post-event. And if it is the females marginalized group like LGBTQ or immigrants, and may intense frequent trauma increased risk, because if we talk about the LGBTQ means that lesbian, gays, lesbian, gays, bisexual, transgender and queer group. So these peoples are normally they are facing a lot of discriminations, and sexual discriminations and physical discriminations, everything, and assault, harassments, everything that they are facing in the normal life. So that becomes a trauma for their life. So automatically it may affect a lot, and if they have undergone the frequent traumas, so that may have the increase of risk factors they may have undergone during that period. And also we talk about the genetic and biological factors like altered brain structures. So in case of in the hippocampus or amygdala, they may, if there is any changes in their brain structure, as well as genetically may have already been their previous generations. So that also a risk for the next generations to undergo this kind of PTSD. And next one is the symptoms. What is the core symptoms of PTSD? First one is intrusion, that is a flashback. Flashback means that they keep on comes in their mind, comes in the face, that whatever the problems that they have undergone, whatever the worst incidents that they have faced in their life, it comes like a flashback. Nightmares, that they couldn't be able to sleep. Okay, they'll get up like wake up suddenly, and it's also called as nightmares. So they don't have a sound sleep, they wake up suddenly by having some sort of thinking or dreaming about the same incident that they happened during their life, or intrusive memories relieving the trauma. So these intrusive same memories that they may have undergone past incident, worst incident that may have undergone in their life, that also relieve everything, relieving their trauma. and intense distress from reminders. So like sights, sounds, smells, that things that related to the incident, past incident, whatever that sight that also related to the past incident that they have happened, sounds and smells also related with the past incidents, that also reminds them again that they may have gone from to the distress period. Example, nightmares disrupting their sleep nightly. So if we see the differences between nightmares and dream is a sound thing that everyone is undergoing in their life, but nightmares is that they couldn't able to have a sound sleep. They have to suddenly wake up in between by having a very pathetic dream, worst dream. And another core symptoms is avoidance. So avoiding trauma, they want to, so they keep on running to face, they don't want to face, they keep on running against this kind of instances related to the thoughts, the places, people or conversations. So that things that may have happened during the past instance, past trauma, so that want to face it or try to overcome it. They don't want to face it. So they keep on avoiding or keep on running against these thoughts, places, peoples or conversations related to their traumas. Emotional numbing or detachment from others, they couldn't able to have a good relationship with other peoples, keep on maintaining the silence with they couldn't able to have a good conversation, they maintaining a silence, and they detach from other peoples, like they don't want to mingle easily with others, and they want to be with loneliness, they be felt very good in loneliness, leads to isolation and loss of interest in activities. So they automatically want to be isolated. Okay, they don't want to mingle with other people, so they become isolated one, and loss of interest in activities. So they don't involve in many like normal activities. They'll keep on refracting themselves from other activities, or keep on distancing them from other activities. And another symptoms is negative changes. If we talk about persistent negative belief, that I am keep on having that, persistent means continuous negative beliefs, like I am broken, a world is unsafe. So they have keep on thinking like that. I couldn't able to do anything in my life. I have been worthless. So that type of thinking that it comes automatically in their mind regularly. So they keep on blaming themselves. They have the guilt. They may have shame or inability to feel positive emotions. So they couldn't able to come out from the negative emotions. They keep on blaming or guilting about their own problems, and they are shaming that they have undergone this kind of to have this trauma or inability to feel. So they don't have any positive emotions, and they can't able to feel the positive emotions. Memory gaps for keep trauma details. So whatever that the memory is there, may have some sort of gaps will be there. Once that trauma happened during that year, the same instance will happen. So in between or before that, they have memory gaps. So that means that they couldn't able to remember. They don't want to remember the good things. They don't want to remember the memorable events. They keep on thinking about only that instance that may have happened in their trauma period. That life becomes a trauma. And next one is course, and one of the core symptom is arousal or reactivity. It aroused their behavior or feeling or whatever it may be, like hypervigilance. So they can't able to keep on vigilance, or sometimes they keep on looking everything that whether it is correct or not. So they search everything everywhere, wherever they are going, wherever whatever that they are seeing. That hypervigilance means அதிகமான பார்வைகள், like ரொம்ப check பண்றது, keep on hypervigilance, like they want to check everything in a correct. So this doesn't have any problems, it doesn't affect anything. That is what hypervigilance. And irritability. So they get tensed easily and getting irritating easily, that whatever things or whatever persons or whoever be there with them that keep on irritating others. Reckless behavior. Say they couldn't able to stand simply or do some simple work. So they may have a restless one. So they keep on moving that side and that side, and exaggerated sort of responses. So that sometimes they have doing more kind of responses. They couldn't able to control that. Like example, we can say it's a workaholic, but keep on working. They want to divert their problems by doing some sort of work. Sleep issues, they couldn't able to sleep continuously. Concentration problems, they can't able to concentrate. Or angry outburst. So keep on getting angry and outburst with others. Fight to flight response stays activated. So they keep on fight or flight. That means once they started running away or started fighting, this is a thing that may happened in their symptom. And next one is diagnosis criteria. DSM-5 that I already told, that diagnostic statistical manual of mental illness, that 5 requires symptoms in all 4 categories, like lasting 1 month causing impairment. So that if we have been PTSD, so it automatically been there for at least 1 month. So once if it is for 1 month, they couldn't able to do any activities, it becomes impaired 1. Clinical assessment via interviews rule out the other conditions like depression. So that they have to keep on undergoing clinical therapies or interviews with a psychologist or psychotherapist, then only they can able to find out the problem what it have been facing, and they can come out like problem like depression, all those things. Tools, PSL-5 questionnaires for screening, so that the psychologist or psychiatrist can give them a PSL-5 questionnaire for screening. That means that the level of conditions that they are being here by knowing through their questionnaire process. And next one is treatment. What kind of treatments that we can give for is psychotherapy. Psychotherapy is also called as talk therapy. It's a trauma focused CBT. CBT means cognitive behavioral therapy. Examined reviews trauma responses. That means they keep on talking about the thing. Then EMDR uses eye movements to process memories. How far they can able to handle that eye movements. And group therapy builds support. So give a group, with the group of people they started giving the therapies. It effective for 60 to 80% of persons. So with the group of same kind of problems that they used to give the group therapy. And next one, if we talk about other treatment like medications and support. Medications means giving medicines. SSRI, that is serotonin, reduces anxiety and depression. It's a kind of medicine. And prazosin for nightmares, that they are suddenly waking up during the night. No, so for that they are giving this prazosin. Emerging ketamine for rapid relief. That is also one more tablet. And lifestyle exercises, if we want to have a good life, that they have to keep on doing exercises. And mindfulness means doing a yoga, meditation like that. And peer support groups. So those who are being with peers, like their age group peoples can give good supports, and automatically they may come out from this problem. Prevention and resources, early intervention post trauma. So if in the initial period itself, if we have find out that means automatically we can prevent this yearly itself by providing psychological first aid. And helplines number is also available. National PTSD hotline number is there, and many resources is also there that you can get a helpline and seek help recovery possible with treatment and end with hopeful quote. Thank you.